We're live.
Welcome to the COVID313 Community Coalition for Students and Families. We are so excited to be here today. I'm Christine Bell, the Executive Director of UNI and your co-moderator for today. We want to give everyone time to get to the right place. So I am going to invite Ophelia to please give us the details on how to listen to Spanish interpretation, because it is new this week and we're really excited about it. Ophelia.
It is. Buenos días, gracias por estar con nosotros hoy. Vamos a hacer algo diferente para la interpretación hoy. Entonces, en los comentarios de este video van a encontrar un enlace donde los va a llevar a la página de Detroit Hispanic Development Corporation para ver este video interpretada al español. Entonces, si no lo encuentran en el chat, también pueden ir a Detroit Hispanic Development Corporation y vamos a estar vivo pronto para poder hacer interpretación.
Thank you so much, Ophelia. And Julie is with us to start today. So Julie, will you please share the instructions for ASL? All right. Thank you, Julie. We appreciate that so much, and we're excited to have you and Katie with us again today. Remember, this town hall is as much about the experts that we bring in as it is about what you have to say and the questions that you have. And we really want to hear from you. So please put your comments or questions in the chat. We have Brooke and Lindsay and Libby standing by waiting to hear from you, or you can text them to 313-288-2082. Again, that number is 313-288-2082. And just to test out, whether we're listening or not, we'd love to hear about how you heard about the town hall today. And also, what are you most excited to hear about? So what topics are you really interested in? And how'd you hear about us today? Put that in the chat or go ahead and text it to us. We really want to hear from you. And we get to welcome I'm really excited to welcome one of our partners back to the town hall. We have Akila from Mothering Justice, and she is going to kick us off today. So Akila?
Thank you so much. I'm really excited to be a part of this coalition. I have my daughter Naima here. She's 10 months and we're attached. So she'll be joining me today for the parent perspective. I'm really looking forward to hearing about the Johnson & Johnson vaccination. One of the things that a lot of the mothers in my community, in particular, like I said, the Black community are concerned about is vaccinating our children. I know that there have been a lot of conversations about how adults feel about vaccinations, but with body autonomy and all of the things that we're trying to give to our children, a huge concern is what are the long-term effects that vaccination for COVID-19 will have on our babies. I know for me personally, I was already concerned about getting the vaccination for myself, but I'm 32 and she's 10 months and my oldest is only 10. So my long-term effects could look different from theirs. And knowing people in my community who have had what they consider to be vaccine injuries due to things like severe allergies and allergic reactions. We all know about the autism challenges that are presented as a result of some vaccinations and the different lawsuits that are going on right now. So it has caused an extreme concern amongst the mothers that I speak to on a regular basis when they think of not only getting vaccinated for themselves, but also vaccinating their children. Another thing about being a Black parent is that I know that I'm aware of scientific experimentation that has taken place in the medical community against Black American citizens with the Tuskegee experiment, with how we got introduced to obstetrics and gynecology, and all of that historical information that I have been able to learn and that a lot of mothers in my community know about. We're all, quite frankly, scared that maybe this is something similar, because how do we know what vaccination our families are getting versus a family that's not of color? And is there any type of variance in that, since now we have all of these different brands of vaccinations? So it's really concerning, and I'm again looking forward to getting some information. I've invited all of my mom friends to tune in, because I feel like the more that we can be informed, the better. I haven't really seen a lot about the testing that's going on currently right now, because I do know that they are in the process of creating a vaccination that is going to be for children. And we know that for herd immunity, of course, children do need to be vaccinated. But for families like mine who have chose to become exempt from vaccination, it's really important for us to know how that can impact our lifestyles so that we can make the best informed decision possible during this pandemic. So I thank you again for allowing me to participate. This is my first time, so I'm really excited to continue to do this work with you all. And I look forward to hearing from Dr. Cunningham about Johnson & Johnson's vaccination and how we can find out more information to make that informed consent decision.
Thank you so much, Akila, and thank you to your lovely daughter for joining us as well. It's always great to see kids on the screen. I'm Rajeshri Gandhi Bhatia, and I am the Director of Detroit Operations for Grand Valley Charter Schools Office. And I'm excited to be here, have been participating in the planning for a while, and I'm excited to fill in for Ms. Jametta, who is not with us this week. As a reminder, we are translating the town hall to Spanish and ASL. So we want to give folks time to get on the right line and get comfortable. Ophelia, could you please share the information for the Spanish translation once more?
I think she just hopped off.
Okay. Can we get Luke to share the instructions for ASL, please?
Of course, claro.
Oh,
Para ver la interpretación de este video en español, por favor, busca en el chat. Oh. Okay, I'm sorry, I had too many screens up. So, para ver este video, en el chat vamos a tener el link para ver en español. Ahorita tenemos un poquito de problemas, pero ahorita sale en vivo el video.
Thank you, Ophelia. Luke, could you please share the instructions for ASL once more? Okay. All right, we'll give Luke a few minutes to get back to us. We'll give those instructions again in a few. Questions on Facebook or text them to 313-288-2082. Again, that's 313-288-2082. Stay on with us for the next 60 minutes so you can stay informed and feel powerful. This is also a time for you to ask experts your questions and have a little fun. To ask your questions, use the chat on Facebook or text your questions to 313-288-2082. We'll have a question and answer after each segment. If we can't answer your question today, we are committed to getting you the answers that you need by early next week. All the questions that are asked today will be posted with answers to onedetroitpbs.org. Again, that's onedetroitpbs.org. So please make sure you ask us your questions. We really want to hear from you. For our experts, please remember to speak slowly for our translators. They want to make sure that they are translating the important information that you're sharing correctly. Also, please turn your cameras off when you're not speaking to ensure that our ASL interpreter can be seen, and mute yourself when you're not speaking. Terry Whitfield is our fantastic timekeeper, and he will chat your remaining time. If you go over your time, he'll let you know that, and our moderators will also gently remind you to wrap up. Today, we have a special town hall that includes community and health professionals who can share information and answer questions about the vaccines. First, we welcome Dr. Dennis Cunningham, the Medical Director for Infection Control and Prevention for the Henry Ford Health System. He has been at the forefront of the fight against COVID and continues to lead efforts to control and contain this virus. Dr. Cunningham, first and foremost, thank you for all of your hard work and everything you've done to help make us safer here. I wanted to bring you on, and to start us off, could you tell us a little bit about the newly approved Johnson & Johnson vaccine and how it compares to the Pfizer and Moderna versions? Many folks were surprised to hear that Johnson & Johnson even makes vaccines when they've been doing so for a very long time. So we'd love to hear from you a little bit more about these vaccines.
I think he may have just gotten bumped off. Let's give Terry, do you see him on the chat? Oh, he's in. There he is. Radisha, you might have to introduce him again because he got bumped off.
Absolutely. Okay, take two. We're going to welcome Dr. Dennis Cunningham, the Medical Director for Infection Control and Prevention for the Henry Ford System. He's been at the forefront of the fight against COVID and continues to lead efforts to control and contain this virus. And Dr. Cunningham, before we begin, we all just want to thank you for your work. Wanted to bring you on, and maybe to start us off, can you tell us a bit more about the newly approved Johnson & Johnson vaccine and how it compares to the Pfizer and Moderna versions? Many folks were actually surprised to hear that Johnson & Johnson even makes vaccines, even though they've been doing so successfully for a long time. And feel free to share your slides to talk through some of this information.
Molly, do you want me to share the slides or do you want to put them up? I can do either.
If you can share them, that'd be great.
All right, happy to do so. And I have them right, where did I put them? Here we are. Can you see the slides? All right, I see a thumbs up. So for those who didn't hear me talk on a previous occasion, my background is I'm trained as a pediatrician and pediatric infectious diseases doctor, and a lot of my research has been in clinical trials of vaccines, and it's something I'm pretty passionate about. I have a slide here, and this is just to show you what are the 3 licensed vaccines in the United States at this time. We have the Pfizer and Moderna vaccines, which I spoke about previously. The newest vaccine that was approved is from Johnson & Johnson. Johnson & Johnson bought a Danish biotechnology company many years ago called Janssen. So I have Johnson & Johnson Janssen on the slide, but that's the new one that came out. The big difference is you only need 1 dose of the Johnson & Johnson vaccine and you're completely protected. About 2 weeks after that dose, you're going to have some good antibody levels, which help fight the virus. None of these vaccines have anything live in them. There's nothing that you can transmit to your family or your loved ones or your friends. The Pfizer and Moderna vaccines use messenger RNA, so mRNA is blueprints that go into the cell and tell the cell make a protein, and it's the attachment protein the virus uses to get in the cells. The Johnson & Johnson vaccine is a little bit different. They use a respiratory virus called adenovirus, and this virus is weakened. It doesn't replicate in your body, but they put the RNA in the virus transports it into the cell. The biggest difference is the effectiveness in the vaccines. Pfizer and Moderna are around 95%. Overall, the Johnson & Johnson vaccine is 70% effective, but it's 85% effective against severe disease. That would be enough that you wind up going to the emergency department, you feel so crummy, and it's 100% effective against hospitalizations and death. We are going to have far more doses of Johnson & Johnson vaccine available in this country. The other advantage is you can store this vaccine at regular refrigerator temperatures. We really have not been able to roll out the Pfizer vaccine to regular doctor's offices and clinics because up until recently, it had to be frozen at something like negative 120 degrees Fahrenheit. Moderna is still a little tricky with freezing, but Johnson & Johnson is so much easier to ship. So that's the important difference there. One of the things that the news has been covering is some rumors that the vaccines have fetal cells or fetal tissue, and that's not true. There are a few vaccines that were developed in cell lines that were derived from aborted fetuses. Chickenpox, German measles, hepatitis A, a rabies vaccine, and the J&J vaccine were derived from these cell lines. These cell lines have been growing since the 70s and 80s. And the nice thing about these cell lines, whether or not you like how they were acquired, these cells keep on going on forever. So it's the same cells that we've been able to use for all the different vaccine and medicine developments. I can assure you there is no fetal tissue, fetal cells, genetic material in any of the vaccines that are currently approved. The 14 largest religions in the world all permit use of these vaccines despite these cell lines. So I did want to share that. Side effects, Moderna and Pfizer, the vast majority of people, very minor side effects. They could still go to school or work. Usually it's more common after the second dose. The big things were tenderness or pain at the injection site, headache, body ache, fatigue, and a little bit of fever after the second dose. The Johnson & Johnson vaccine, it actually has less side effects. You still can get tenderness. You can also get headaches, body aches, and fatigue, but at a lower rate than you would with the other vaccines. So all three of them are pretty effective. All of them will give protection and help to get COVID under control. But that's the quick overview about how Johnson & Johnson's a little bit different from the other vaccines out there.
Great, Dr. Cunningham, that was very, really helpful. Couple of questions, just, as time passes and this virus does what viruses do, which is mutate, we have a number of variants of the disease out there, the virus out there. Can you speak to the effectiveness of these vaccines against the variant strains?
Sure, so it depends what variants. There's four big ones in the news. The New York strain just detected, the United Kingdom strain, which the vaccines work very, very well against. The South African strain, the vaccines are not quite as effective, and we're still waiting for the data on the Brazil strain. I can tell you that all the vaccine manufacturers are looking at how they can modify or tweak their vaccines just a little bit to cover these variants better. So I showed you the slide where Pfizer and Moderna are 2 doses. It's very possible that it may become a 3-dose series, with the 3rd dose being specifically adapted for the strains that are circulating. Johnson & Johnson's also looking at a vaccine giving a 2nd dose, which would be more directed towards the variants. This may turn up being like flu, where every year we need a little bit of a different vaccine to take care of these different viruses as they emerge. I don't know that for sure, but that's my guess.
Okay, that makes sense. And relating it back to sort of the way that the flu vaccine works is helpful to us who are not infectious disease specialists to understand this kind of thing. As parents struggle with the impossible choices related to getting kids back in school versus them at home and all of what comes with it, which Akila spoke to a bit in the beginning also, can you share a little bit more about vaccines in children and help parents understand how safe their kids are at school, if it varies by age? And lastly, if there's anything parents can do to keep their kids safer?
All right. Well, I will say one thing. There are some studies now where in children whose parents and the children agree to be in studies, clinical trials, they are looking at these vaccines. My guess is we may be able to offer these vaccines to children sometime in mid to late summer. Moderna vaccine, we can give it to people as young as 16. The other vaccines are approved for 18 and older. Kids can still go back to school. My children have been back in school in person full day since probably mid-November. They're older. One's 7th grade, one's in high school. And so those grades, the kids are really good at wearing masks, which I think is the single most important thing they can do. The schools are spreading the kids out at lunch where they put extra tables and picnic tables in the cafeteria so they can sit a little bit apart, that they're not right on top of each other. So it can certainly be done. It is harder when you have young children, getting them to keep a mask on, especially, preschool, kindergarten, first and second grade. But, CDC's looked at the data and it looks like kids can still go to school and the rates of infection are pretty low. So I think the more harm is occurring from children not learning and not getting that social environment. When my kids were out of school, they were going crazy without their social interactions. They go to school also to see their friends, play games, play sports. And I'm happy. For me, it was an easy decision. I felt they should go to school, but every parent has to make that decision. As far as deciding whether or not give your kids vaccines, I remember when my kids were little, these are overwhelming decisions what to do. The topic of autism and vaccines is a whole nother thing I could talk about a while. I will email you some links that say there is no association from the American Academy of Pediatrics and the CDC. As far as vaccine hesitancy, I can get that parents are concerned about what's been done in the past. It was awful. There's just no excuse for ever treating a group of people like the Tuskegee Airmen syphilis study. It's just reprehensible. It's really hard to earn the trust back after something like that. I can just tell you what I've done for my kids is I've chosen to get them vaccinated. I've seen too many kids die from things like chicken pox, whooping cough when I was working at a children's hospital, and I never want to see that again. But that's a personal decision for parents to make. My job is not to twist your arm and tell you you must do this. I like to give information and then let the parent make the decision that's right for him, her, and the children.
Thank you. And one of the things I heard you say at the beginning there was wearing masks and distancing is really what's helping to keep kids safe at school. So the more we can encourage that, the better. I can tell you, I have a 5-year-old and she's in kindergarten, and she and her friends, are very good at keeping their masks on. In fact, they're great at checking each other and doing the social distancing. She tries to do it at home, and I have to remind her, like, no, mom can still give you a hug, but at school you should definitely keep your distance. So it's encouraging to hear that it's things like that are helping to keep our kids safe. You mentioned a couple of sources, and I think that's another question that parents and folks have is there's a lot of information out there, and some of it can be confusing and some of it can be conflicting. Where do you recommend that people who are listening go for this information? Besides this town hall, obviously, where else can folks go to get information about the vaccine, about COVID, just in general?
So I just typed up one. It's called www.immunize.org. This is a group of parents who had kids who died from vaccine preventable diseases, and their mission is to just give education out to people. They do have some medical experts on their team, but everything's written in a very, very easy to understand non-medical person. I mean, you're all smart people, but I don't expect you to know the same terminology in infectious diseases. I'd be lost if I was doing your jobs. So I like it that it's very readable. I do like CDC as well. And I also like the American Academy of Pediatrics. And I'll put some links in the chat box that people can look at.
Great, that's really helpful. Thank you. As we kind of close out before we go to questions and answers, how hopeful are you that we can resume a lifestyle that more closely resembles what we experienced before this all started? When do you see that happening? Do we see travel and community gatherings as a part of our near future? And what is it going to take to get us there?
Boy, I sure hope we get back to traveling, because I really like to go somewhere warm this time of year, and obviously I didn't, and I'm sure other people have the same thing. I think we'll be able to do community events. You probably will see masks as part of them for the foreseeable future. I could easily see a need for masks into 2022. If I'm wrong and we get rid of them before then, that would be wonderful. I've started to go out to some restaurants, the places where they're being careful, putting the tables apart. I do want to live my life and enjoy things, but it's going to be a while before we get back to normal. I think the vaccines and the masks are really the two tools we need to use. I'm actually very dismayed a few states are getting rid of the masks. I'm worried that's going to cause some surges and we're going to lose ground.
Absolutely. Absolutely. Wonderful. Thank you so much. We're going to take a few minutes to get some live questions and answers from our audience. Those of you watching, please be sure to post your questions in the Facebook chat or text them to 313-288-2082. Christine, do we have any questions?
We do. They're rolling in. So,
Go
and
for it.
some questions actually have been answered, but I might ask you just, Dr. Cunningham, to briefly maybe just give the answer again. Thank you. This was all really, really good information, and thank you for very directly addressing the fetal tissue issue, since that has been something that I know has been on a lot of the folks that our organization serves mind. So the first question is, do people get a choice to which vaccine they want?
So we have not been able to do that. And the reason is I have no control over what vaccines I receive. The federal government buys the vaccines, they ship them to the states. The state health departments then say, you're getting this vaccine or vaccines, you're getting this vaccine. I suspect you're going to see the Johnson & Johnson vaccines more in health clinics and vaccination sites outside the hospital, because you don't have to freeze it at super, super cold temperatures. My advice is, if you're offered a vaccine, get it. I have no idea how long it's going to take for us to have lots of all the vaccines, but Johnson & Johnson is going to be flooding the market soon in a good way. Merck, which is another giant pharmaceutical company known for vaccines, is partnering with Johnson & Johnson, said, hey, you can use our factories to make even more of your vaccine out of a spirit of cooperation. So that's also going to help get more vaccines here. And the last thing I just want everyone to know, even though I've done clinical research for vaccines in the past, I'm employed by Henry Ford. I'm salaried, so I have no financial interest in anything except that I'm a dad and I love kids and I want to keep them all safe. And I just want to make sure people realize that.
Thank you for that, Dr. Cunningham. And I have a follow-up question to that. Is the reason why the federal government purchasing the vaccines, and then distributing them, is that so that the vaccine can be free but why, or is that normally how vaccine distribution
It's normally
works?
not done that way. The government usually only gets a small portion of vaccines for children, which is for Medicaid eligible children. The reason the government did this is typically the companies study a vaccine, submit the data, and then once it's approved by the Food and Drug Administration, they start making the vaccine. The federal government said, hey, this is a public health crisis. Start making that vaccine. We'll cover the costs, but just start making it. So if it gets approved, we can roll it out right away. So it was really to just help address a public health crisis.
Okay.
So we've already
And the
paid for it
vaccine,
with our taxes.
okay. And the vaccine should be free to folks, correct?
Correct. The vaccine, there's no charge for it. Sites are able to charge a small amount for a vaccine administration fee. That's standard. However, if people don't have insurance or the insurance doesn't cover that administration fee, we are required to waive that. So there is no out-of-money expense for any of this for you.
Okay. And then, Dr. Cunningham, I heard you say, but I just want to reiterate because somebody raised the question, would you get your own children vaccinated? And I think I heard you say yes, but could you just confirm that?
Well, they have all the currently recommended vaccines for children. Will I give them Johnson, Pfizer, or Moderna? If the data looks good, absolutely. I was vaccinated with Pfizer because that's what Henry Ford had at the time. But I plan on vaccinating my children, and my wife, who's a nurse practitioner, has the same thoughts as well.
Okay, so if someone isn't able to get the second dose of Pfizer or Moderna at their scheduled appointment, do they need to start over again?
No, it's with vaccines, you can space the two doses further apart without a problem. You just can't bring them closer together than the recommended interval. So if you got one dose now and you are offered a second dose in 5 months, no worries.
Oh, great. That's really good to know. So you said a little bit about this. You talked about Texas and some other states that are lifting their mask mandate. Do you and you shared your thoughts on it. Do you have any additional thoughts, and what should we expect here in Michigan, or what should we expect to hear? What happens? What should we expect by lifting those mask mandates?
So I don't know if you saw on March 1st, the director of the Centers for Disease Control and Prevention said, hey, we're not decreasing the number of cases anymore. You know, we were going down and now it's flat. I actually was looking at the daily cases by county in Michigan. Jackson County and Oakland County and Wayne County look like they're having a small increase. My fear is if we're not really careful, we could go back and have another large wave where our hospitals are just overwhelmed. You know, the healthcare workers, they have done a heroic job. They're getting tired. I'm tired. We'll do whatever we need to do, but I'm just praying we don't have to go through that again.
Thank you. Which vaccine has the least counter reaction if a person has already had the virus?
So anytime you have the virus and you get the vaccine, you're essentially, the natural infection's almost counting as a first dose. So you could get a few more reactions than the average person. Out of the 3 vaccines, the side effect profile is a little bit better with Pfizer. So my guess is Pfizer would be the one that would cause the least amount.
Great. And then Fauci, our favorite doctor, Dr. Fauci says, we need kids vaccinated to get to herd immunity. Can you say more about this?
Sure. So herd immunity means you get to a percentage of the population vaccinated. And what that means is when the virus goes into a population, there's not enough people who are susceptible for the virus to start another epidemic or pandemic. We do know that kids bring a lot of germs home to their parents and grandparents. You know, toddlers in preschool, they do not want to share their toys, but you want some snot, hey, they're happy to share with you. So I believe that's what Dr. Fauci was addressing. We know, for instance, influenza. In the 1980s, Japan was mandatory vaccinating a flu for all kids up to 6th grade, and they essentially got rid of flu in the country because it's our little loved ones who are the culprits for spreading it and bringing it. Doesn't surprise us. They're not as good at washing their hands, sneezing into their elbow, and that type of thing. But that's what he's referring to.
Yeah, I will say we have had far less colds and sickness in my house since quarantine.
Do you know how many cases of flu have been detected in Michigan this year?
No, I do not.
3.
Really?
In terms of laboratory confirmed influenza.
3?
3. I know it sounds unbelievable.
That sounds really unbelievable.
But when you think about it, when's the last time you had a cold? I haven't had a cold since probably last November. I mean, November of 20.
Yeah, we had a bit of a cold run through our house, which created but it wasn't, everybody had symptoms for, like 24 hours, and it just kind of rolled through everyone. And wow.
Public health does surveillance of people who come in with respiratory symptoms. They ask certain sites to report if people have influenza-like illness, if they have colds, and the number of those has almost vanished.
Well, I don't want to encourage us to stay in the state that we're in, but I think it's a testament to how important, what we've been doing together that has been so hard for all of us, but how important it is. And I'm being reminded to speak slowly for the translators. So I really want to thank you. This was really helpful. I want to just make sure that no more questions came in. They did not. And I just also really want to lift up what you said about our healthcare workers that have been that have been at the front lines of this. And I want to lift up what you just said about people being tired, and really just thanking you and the team that you work with for caring for us and showing up every day so that, we could, so that you could heal people. So thank you. Rajesh.
It's an honor to be entrusted with someone's care, especially when it's their children. That's the way I look at it.
Thank you so much. And actually, I think I'm going to get to introduce the next person. So, oh, wait, we have one more. Sorry. Do you anticipate the flu season being worse, cold season being worse, since there are less cases?
What flu season? We're not seeing it. I'm being a little funny, glib when I say that, but I don't think we're going to see flu this winter. Flu season is typically between September to the end of March, and I don't think we're really going to see it. Next year, will it be worse or not? I don't know. The one thing about viruses, they're unpredictable. I don't expect it to be any worse. If we're still wearing masks, I bet it's going to be easy peasy next year too.
Great. Well, thank you. Thank you so much, Dr. Cunningham. We really appreciate your time today and all of your really valuable information and your directness and the resources that you've provided for our families that want to know more information and really start to dig into what is the best choice for their family. So thank you so much, Dr. Cunningham. And we are now going to welcome the Detroit Health Department. And we have Hannah with us again today. And Hannah, will you just pronounce your last name for me so that I don't?
Yes, it's Ewing, like Patrick Ewing.
Oh, okay. Are you related?
No, unfortunately.
Okay.
Skills. You don't want to see me play.
Okay. Well, so Hannah is with us again from the health department, and we really appreciate you being here with us again today. And we want to remind folks, if you have questions, to please put them in the chat, or you can text them to 313-288-2082. And so, Hannah, sometimes you come to us with a presentation. Do you have a presentation today, or should I jump into our questions?
I have a
because we come with questions.
I have a presentation with lots of new resources for you guys, so I would love to share it.
Awesome. All right. Well, are you going to share, or do you need us to share the screen?
I can share, not a problem.
Great. Thank you. Yep, we can see it, and away we go.
All right, so my name's Hannah Ewing. I am one of the registered nurses on the outreach and education team at the Detroit Health Department. I'm excited to give you an update on our vaccination work and give you a COVID update on the state of the disease in the city. So the city of Detroit, as of yesterday, we've had 28,038 confirmed cases of COVID-19 with just over 1,800 confirmed deaths. Our average positivity rate has been about the same as last week. We saw a little bit of an uptake early in the week, but now we're down to a 2.6% positivity rolling average. Our average number of COVID-19 tests have increased from 1,800 of last week to 1,900 tests per day in the city of Detroit. Michigan, as of earlier this week, we've had over 650,000 cases of COVID-19 and over 16,000 confirmed deaths. Detroit, in comparison to Michigan, Michigan in comparison to Detroit is a little bit higher at 3.2%. And we're seeing our COVID-19 test being just over 35,000 a day. So we're going to talk a little bit about the benefits of getting the COVID-19 vaccine. So the first is that the COVID-19 vaccination will help keep you from getting COVID-19. The vaccination is also a safe way to help build protection against the virus. And the COVID-19 vaccination will be an important tool to help stop the pandemic. And I talk about it as a tool because we still need to practice good mask wearing, hand hygiene, and continue to socially distance. And we've also wanted to share a couple of our resources that we have on the health department website. You can find these at detroitmi.gov/health. And there's lots of information that if you're wondering something, you can do your own research. And I also love to have these questions as a good springboard for conversation. So if you're talking to your doctor, considering asking them a few of these, and just kind of think about, are these questions that you have? And then if you have additional questions, you can always email us at dhdoutbreak@detroitmi.gov, and we would love to include your questions on our website. And we are going to give an update of our COVID vaccination rollout. So it's a very important milestone today. We are almost at 100,000 doses administered. We've administered about 78% of all the doses we have. We have scheduled an additional 55,000 future doses from tomorrow, which is the 5th of March, until April 1st. We've received just over 120,000 doses of a combination of the Moderna and the Pfizer vaccine. We have not begun administering the Johnson & Johnson vaccine as of yet. Some important groups, I love this, the way that they've broken up the data, is it shows exactly who is getting the vaccination. So we've vaccinated over almost 40,000 of our 60+ residents. We've also been starting to do our community pop-ups, and at that we've gone just over about 494 people. We've vaccinated almost 3,000 clergy members, and we've almost vaccinated 10,000 of our K-12 teachers and school support staff. And we always encourage returning to our website and watching the work that we're doing as a team. Additionally, we wanted to show the COVID vaccine coverage by jurisdiction. So we see in the city of Detroit, we're almost at 11% of this eligible population being vaccinated. Macomb and Oakland County have higher rates of vaccination. And the reason is because they are being vaccinated by the hospital systems, and they're doing a really good job getting all of their patients in. But we hope to continue to grow this number in Detroit. Last week, you also asked some really great questions about the vaccine in terms of race. So if we look at our new breakdown we have on our website, we have the Detroit residents dosed by race. We're just over 80% of our people in the city of Detroit have been vaccinated are Black or African American. We see about 15.4% of those in the city of Detroit being white, and 2.9% are classified as others. It's important to note that the race is self-determined, so the patient is just deciding which bracket they fall into and how they personally identify. And some people, about 30.8%, have chosen not to include this information, and that's totally fine. We see the all doses by race, and this is a little bit different because, as we'll talk about further in this presentation, is that we're also vaccinating people who come into the city to work for Detroit, whether it's the doctors and nurses, or some of the janitor staff that's coming into the city to work, because they're also eligible for vaccination at the city of Detroit, because they are the ones who are keeping our city healthy, and they're also reducing the risk of COVID-19 by getting vaccinated themselves, so they don't bring it in from another community that maybe has a higher percentage of COVID-19 in the area and bring it into the city of Detroit. So that's the difference between those two numbers. Something we talked about last week, which we're really excited to bring to the community, is our Power Hour, which is a conversation that takes place every Monday through Friday from 4 to 5 p.m., where residents and the people from the city of Detroit can give us a call and ask us any question they have about the COVID-19 vaccine. This is a program that's covered by my team. So you can call the number 312-626-6799 with the meeting ID of 848-7714-7801, and I will happily put this in the chat. And you can ask us any question you have about the COVID-19 vaccine. The line is manned every Monday through Friday from 4 to 5 p.m. by one of our healthcare professionals, being a health communications specialist or a registered nurse. And throughout in the coming weeks, we're going to try to increase our language accessibility, adding languages like Spanish, Arabic, and Bengali. So we have different days of the week that will be available to those community members who prefer to speak those languages, and make sure that they're comfortable asking the questions in their preferred language. So let's talk about our vaccine eligibility updates. So we've opened up the vaccination at no cost to anyone for our manufacturing employees, provided that they live or work in the city of Detroit. Additionally, we have expanded our good neighbor to include anyone who is 55 years or older, who lives in Detroit or in Michigan, who drives a Detroiter age 60 plus to the TCF Center vaccination site. It's important to note that if you live in the suburbs and you're bringing a Detroiter to the TCF site, you both must make your appointments at the same time so that we can make sure that we have the right amount of vaccine allocated for your appointment. Additionally, we have any resident of the city of Detroit who is over the age of 60, our child care providers and K-12 school employees, our adult foster caregivers, and many other on this list. We also have our Detroit residents with intellectual and developmental disabilities, and caregivers, residents, and home health care providers if they travel in the same vehicle during the appointment. So it's important to note that one live-in caregiver per resident, and there must be evidence of a condition required at appointment. Whether this is a doctor's note or a prescription bottle, we're very flexible and want to make sure that our community can get vaccinated. So how to schedule an appointment at the TCF Center? You can always call us at 313-230-0505 Monday through Friday, 9 a.m. to 6 p.m. and choose prompt 1 to make an appointment with the vaccine option. If you are in one of the identified groups and you want to receive your vaccine, you're going to provide some information like your name, address, date of birth, phone number, email, and have you ever had a previous allergic reaction to a vaccine. This information allows us to schedule your appointment and also give a heads up to the healthcare providers to make sure that you are eligible for the vaccine, and if we need to watch you for an extra 15 minutes. If you fall in one of those essential worker categories, please bring proof of employment, like your employer name, your work address, and you can always take a picture of your employee ID on your cell phone so you don't have to have the physical badge with you. At the time of your call to the TCF Center, you will be given an appointment for 2 vaccine dates, and you will be given reminders and instructions that will be sent via text or email. If you are not currently eligible, we recommend that you check back for updates at our website, www.detroitmi.gov/health, and we will keep updating our eligibility as we get more and more information and more doses. We also have, for those who prefer to speak in Spanish, Arabic, and Bengali and are more comfortable communicating in those languages, you can call the number 855-393-4432 to get connected with a translator to make your appointment at the TCF Center. And as always, what to expect on appointment day: arrive on time and bring your ID or something that has your name and your date of birth on it. While it's still cold outside, make sure to wear a short sleeve shirt under your jacket so that the clinician has easy access to your arm for the vaccination site. And you will stay in your car the entire time during this process. We're also expanding our Senior Saturdays COVID-19 vaccine sites. You still make an appointment through the same way as you do for the TCF Center, and let them know which one you would like to attend. And if you don't know which one, just give them your address and they can look up the closest Senior Saturday vaccination site. So again, that number is 313-230-0505, Monday through Friday, 9 a.m. to 6 p.m. And we have appointments at the following locations: at the Greater Emmanuel Institutional, at the New Providence Baptist Church, at the Grace Community Center, at the Kemney Recreational Center. And I was there working last week, and it was a really great facility. And we vaccinated a lot of our community members in Southwest Detroit. We also have our Fellowship Chapel and our Second Ebenezer Church. And as we continue to get more vaccine supply, we will continue to expand our community partnerships and go into all areas in the city. And for additional resources, here's our information. You can always call us at our COVID-19 hotline at 313-876-4000. If you prefer to talk and communicate via email us at dhdoutbreak@detroitmi.gov. And you can always visit our website, www.detroitmi.gov/coronavirus.
Great. Thank you so much, Hannah. You answered a lot of the questions that we that we had. The one question that I wanted to raise, and I actually got my first dose on Friday, and so I first want to say it is a really efficient process. And the nurse that vaccinated me was amazing, and she was just so wonderful, and so was everyone actually that I came into contact with. But I think the question that I'm going to ask you was really driven home for me when I was there, is that you know, you need to be able to speak English to get through that process. And so we're curious where we are, where the health department is in translating documents, and then also expanding potentially vaccine sites to into communities, and with community partners that are able to support folks that are natively speak other languages. So can you talk a little bit about that? And then I have a question from the audience that I want to ask, and we've got about 1 minute. So if you could, go ahead.
So we're working actively on translating all of those documents. And then as far as our community outreach for Southwest Detroit, we had a Spanish speaker on site. I worked with Ana Martinez and we worked together. My Spanish, I have some, it took a couple of years, but it was really nice to have her there. She decreased everyone's anxiety. And so we're working to have more of those local community sites, and then also have our staff members who represent the community and speak the language. So that's something we're actively working on.
And then Hannah, is there another way to set up appointments for non-English speakers?
The only number I know is that one, but I can see if there's another option. And if not, then we'll work with our community partners to make sure that we have the right people to connect them in the language that they are most comfortable speaking in.
Okay, and then you know that as a community, we have the ability to translate. So please don't hesitate to call on us, and we are more than willing to support the health department, because what's most important is that you know, our residents are able to get the information in the language that they're most comfortable with. And the last question that I have is, when will vaccines, and so hopefully this person is listening, when will the vaccine be open to construction workers? Very specific.
That's a great question. I will send that one up the line. That's a decision that's being manned by the state of Michigan and also Mayor Duggan as well. So we're looking at all the data, seeing who's eligible, and I will get the answer for hopefully ASAP, and I will email you guys back.
Great. So this is not a question, it's a comment, and so I'll read it out loud. I'm not sure why it's necessary to include disinformation at the start of this presentation. We have lots of data that shows the lies spread faster than truth. The person providing disinformation did not state to hear facts. That does not surprise me, and I question the judgment of including lies in this presentation. I'm going to ask our folks to get some additional information from the person that just shared this comment, and Hannah, we'll make sure we get that to you so that you can clear anything up. And we appreciate you coming to us every week, answering the questions that we pose to you. And when you don't know them, this is not referring to your presentation, it's referring to another person's presentation. But we really, I appreciate, and we all appreciate that you take the information or the questions, and if you don't know the answers, you bring back the information. So thank you so much for the information on the racial breakdown of vaccines, since that was heavy on our mind here. And we will see you next week again, and I am going to turn it over to Rajeshri. Thank you so much, Hannah.
Thank you very much. That was a very, very informative. We appreciate all the efforts. We are now going to invite Mr. Jamal Simmons, who will give us insight into some national policy conversation. Jamal, could you please turn your camera on and join us?
Hi, I think I'm in. Can you see me?
You're good.
Okay, sounds good. It's good to go after the Detroit Health Department. I spent 2 summers in college working at Herman Kiefer doing HIV AIDS training classes, so I'm very familiar with the building, the old building. I guess I'm just here to tell you about what's happening in DC right now around COVID. The big news, which many of you have probably paid attention to, there's 2 big pieces of news in the last week. One is that the president of the United States, Joe Biden, put in place that everyone now is going to be focused on getting educators vaccinated, both people who are in school, school employees, and child care workers. So people who are, at daycare centers and are doing child care for a living. So that's gonna, they're doing that to try to get kids back in school by the beginning of the 4th quarter of this year, which I guess is April. So it looks like the concentrations to try to do that in March. Some of these new doses may not show up until April. The federal government is going to ship doses directly to pharmacies, so they won't have to go through a lot of the local bureaucratic process. They'll go directly to pharmacies and people can get inoculated there. The other piece of big news this week is that there was a deal struck in the Senate on the $1.9 trillion pandemic relief bill. And so what's going to happen now is instead of the income threshold being $200,000 a year, they're going to dial that for couples. They're going to dial that down to $150,000 a year. So everybody up to $150,000 a year is going to get $2,800 per couple. And that will go up to, it'll phase out at $160,000 a year. So at 150,000, you get the full 2,800. That number will ramp down up to people who make 160,000 as a couple, and then it goes to 0. If you are single, it's $75,000 per person, up to 80,000. If you are single with children, I think it goes up to about $111,000 per person. So single individuals with kids will get more money than single individuals without kids. So that's the big thing. And then unemployment checks are also going to be ramped up or keep going, $400 a week. That'll keep going until September. And then some of the other protections that went into place over the course of the last year for folks because of the pandemic. All that stuff is going to be re-upped and stay in place. I think like the renter eviction moratorium is going to come back online. So people won't be able to get evicted for at least another few months. So, I mean, that's my general update. I mean, there's a bunch of stuff happening in Washington. We can go around the horn. Congress is shut down because they're worried about another insurrection taking place today because of the QAnon people. The bill in the Senate, I guess this is the last point about the bill. This bill in the Senate, it's unclear the day they're going to start considering it, but it'll happen sometime, we think, in the next week or so. But some of the more conservative members, the Republicans, are trying to gum up the works a little bit and put some stuff in place to keep it from happening fast. So one of the things they will do is Senator Johnson from Wisconsin wants them to read the entire 600-page bill, which will take about 10 hours of them reading the bill out loud, which will slow it down from being passed. So it's just machinations of politics. Ultimately, it'll get passed because the deal's already been done with the majority of the senators.
Thank you so much, Jamal. I'm sure we have some questions. Christine, do you have any to share?
So you had said, could you repeat again what you said about the stimulus dollars and where that is in the legislative process?
So the House already passed a bill. The Senate just did a deal with President Biden, and they limited the number. So in the House bill, if you made up to $200,000 a couple or $100,000 a piece, you would get this money, which is $2,800 per couple, right? So now in the Senate bill, they're going to cut that back to people who make $150,000 a year. Then it'll phase down after that to $160,000. So it's just for easy. If you make $150,000 a year as a couple, you're going to get $2,800 check from the government, scot-free. Just a check will show up in your bank account. If you are an individual, that means you make $75,000 a year, you're going to get a $1,400 check. If you are a single person with kids, a single parent, you will get, I think that goes up to $111,000. So single people get $1,400. Single parents will get that up to $111,000, and then couples together will get $2,800, depending on how much money you make.
And then Jamal, is so in the past stimulus that has been given to residents, there's also been an amount that's been given to each child.
Mhm.
So is that the same in this bill, or is it just given to the heads of households?
The child money is in there also. That is also income capped at it's the $111,000, I think, for a single parent, or $150,000 for a couple.
Great, thank you. And then you talked a little bit about the eviction moratorium, and I know that is weighing on our residents' minds, and also, quite frankly, the organizations and that work for residents, ensuring that they can stay in their home. And it's weighing on the minds of landlords that need that rent to potentially pay mortgages and repairs and things of that nature. So can you say more about what the moratorium might look like, and then is there any support coming to landlords?
Yeah, I don't know a lot about this, but I know a little bit about it. The moratorium will stay in place. You can't evict people. There is money in there for home assistance and for rental assistance. So for instance, my wife owns a small condo that she had before we got married, and she's got a renter in there who is hasn't been employed, but is able to apply for rental assistance from a nonprofit agency. So that nonprofit agency is covering, I think it's like 80% of her rent, which is helpful for all of us, right? And so I think for people who are like that, who just have like one person with a house that they are renting out to somebody, that sort of works. I think if you're a big, larger company and you've got multiple units, I think there's a different situation. But I think for the folks who have smaller kind of mom and pop landlords, they can get assistance through these other agencies.
Great. And so we do have a question from the audience, another question about the checks. So hopefully you can answer this. Okay. When do you think checks will reach people's pockets? And I heard people get money per kid. Is that true? And you did answer that yes. But if you could,
you do get money per child. When it's going to happen is a thing that nobody knows, because it depends on when the Senate actually schedules the vote. So once they schedule the vote, there'll be a couple of days of shenanigans between the politicians and the senators who are going back and forth trying to figure it out. Then what they're going to do is what they call a vote-a-rama. And a vote-a-rama is when they have all these bills that people want to do, all these amendments to the bill that people want to pass, and they just do them all one at a time. And they stay up all night and they just kind of try to run through it. And partly what they do is, because this is the political season, is people are trying to force votes that will make politicians have a tough thing to defend in their campaign. So somebody will throw up something like, oh, you shouldn't have drug needles, and if you're an organization that counsels people on, sharing needles, then you can't get the money, and then they'll vote that down. And so then somebody will run a campaign ad and says Jamal Simmons supports giving needles to drug offenders, because you voted against that bill. So that's the political kind of chicanery that will take place. That'll take a couple days. So my political guess is the Democrats have committed to having this bill passed by March 14th, so that there's not an additional lapse in coverage for the checks. So passage by the 14th, they want to keep unemployment flowing. They don't want to have any gaps in unemployment. And then at some point after that, I'm not sure how many days it will take for the $1,400 or $2,800 checks to show up in mailboxes.
I think it's interesting that it's called a vote-a-rama. Kind of, it conjured up cartoon in my mind.
It is a cartoon.
Which Yeah, which is concerning, seeing that
Yeah.
we're not living in a cartoon,
Right.
and this has been incredibly difficult. So, but that's interesting. So
Well, if you've ever been to
very
Capitol Hill and you ever go to Congress, a friend of mine when they first went said this place is Disneyland. They've got a tram. You know, they send out like
Yeah.
congressmen and senators kind of walk out from time to time. People take pictures. They disappear behind the walls. So it's just like that, and ridiculous things happen while real lives are at stake. But it's a silly process, but it is the way things get done.
Absolutely. And actually, I appreciate that you're sharing it, because I think I have learned so much in the last year about our government and how it works and how it operates. And if you think about being grateful for something in this time, I'm actually really grateful for it. Somebody asked very specifically, do you know how much per child, what's in the bill, how much a parent would get for each child?
I don't know. I was just trying to look up that number before we got started. I don't know. It is the same number it was before. So I don't know what that number is, but it is the same amount that they cut last year.
Okay, and I'm trying to, I have 3 kids, but I can't actually remember how much that was.
Right.
$600 pops into my head, but I
Yeah.
don't want to be accused of sending misinformation. So
There was a
that's
little
all the
back and
questions.
forth. I'm sorry. There was a little back and forth
Yeah, go
over the unemployment number. So I think Senator Manchin from West Virginia wanted to cut unemployment check down to $300. The House bill has $400 in it for unemployment checks. Senator Manchin wanted to make it $300. He dropped that notion, so it will stay at $400 a check for unemployment until September or until August. Somebody else wanted to go through September, but I think that was the deal. They left it at August and then kept the amount the same. And if they need to go back, they'll go back and pass another bill after that. But we'll see where we are after all the vaccines.
Yeah, I was just going to say, is that is the August date because they're hoping that the economy will look different in August because of the vaccine?
Yeah, everybody's playing a wait and see game. It all depends on how fast, everybody gets vaccines in their arms, how fast, the president has said that we will have enough vaccine for every American by May. So the question then becomes, when do we have enough people who can actually administer those vaccines, and how fast they can do that. So some people have said it will take till the end of the summer to get everybody vaccinated. Some people have said it'll be in early fall, but you should expect that at some point there'll be enough people vaccinated that places can begin to open up more, and then you'll have more economic activity. Maybe people will be able to go back to work. And there's a bunch of pent up demand. I mean, all the people who do this from the business side are all saying, they're all investing in the kinds of things people want to do when they get free, right? When the quarantine's over. So travel companies are starting to see upticks in pre-booking. People want to figure out some of the clothing companies, because nobody's gone shopping in a year. So people who have money haven't been spending it, and people who need money and need work are going to have at least this bridge over time, and hopefully they'll be able to get back to work beforehand. Oh, which brings up the last point, which is the minimum wage. The minimum wage was taken out of the bill as part of this negotiation because of the Senate parliamentarians' strange rules. Because they can't get any Republicans to vote for the bill, it's going to have to pass by 51 votes, which means it goes through this thing called reconciliation in the Senate. It's a different kind of process. And that meant the Senate rule maker, the parliamentarian, said the minimum wage does not count. You can't pass that under reconciliation. So they're not going to do that. So now there's questions about, will they bring back a minimum wage bill separately and try to get a $15 minimum wage? There are Republicans like Mitt Romney, who ran for president 10 years ago. There are Republicans who are saying they're for a minimum wage, but not $15, maybe $11. So that tells you if there's a bill, maybe the floor for that bill is $11 for the Republicans. The Democrats want $15. Maybe they compromise somewhere around $13.50, right? $13. So maybe there's a deal in there, which if you make the minimum wage, that's not going to be, exciting to lose those $2. But, you might go from $7.25 up to $13, which ain't nothing.
Yeah, absolutely. Well, and even that it's on the table to have the conversation is a good one. Well, that's all the questions we have. I'm going to let your dad wave at you again, because that's what I remember as a child.
Yes.
And I'm now a parent, and I found myself doing the same thing to my kid that embarrassed me so much when I was a child. So,
well, and then when you have your
because-
own kids, you kind of understand the instinct, so you become more forgiving.
Yeah, absolutely. My son, when he did his first dance recital, I was up from the nosebleed section, like waving my hands. It's like almost instinctual.
Yeah.
So,
What
Well,
we do?
well, thank you for having. Thank you for having me. I do want to say I know this is seriously, this is one of the hardest things we've ever been to as a country, and for communities. It does feel like there's a end of the road that's coming. Obviously, we all have to continue to do all the things to stay safe, distancing and mask wearing and all that. But I was a vaccine skeptic a year ago. I'm ready to get mine now. I gotta get out of the house. So I'm hoping that we in DC start to get those, in May or June. So hopefully we can all get back to work, and I can see my family who I haven't seen since, I don't know, last Christmas or something like that. So I'm happy to do it.
Oh, well, thank you so much, Jamal. And we really appreciate that you are doing your dad a favor and coming to us from Washington, D.C. And I can tell that you were raised by him by your last hopeful comments, because Rev always gives us the hope at the end. So thank you so much for being with us. Rev, do you want to say anything to Jamal?
It's yo. Give the kids a hug for me.
We'll do.
See them soon.
We'll do.
Isn't your
All
birthday
right.
coming up?
It's the 8th. So
Yeah,
Monday.
that's what I thought.
Yep.
Okay.
All right,
All
y'all.
right. So,
Thank you.
Granddad, remember to send the birthday money.
Yes.
That's how I knew.
All
I
right,
got a
thanks.
reminder.
Bye.
Thanks, Jamal. You have a good
Bye.
rest of the day.
You too.
All right. So here we go. We are moving on to the next part of our agenda. And we just want to thank Jamal again. And if you have questions or comments, please remember to put them in the chat. Or you can text them to 313-288-2082. And it is always my pleasure to introduce Miss Arlisa Hurd, who is going to give us a state update on the federal stimulus dollars that are in the state of Michigan, waiting to be distributed, so that we can have some additional dollars for schools and housing and all sorts of things that we need right now as we're working through this pandemic. So, Ms. Hurd, the time is yours.
I didn't know that's what I was doing here today, Christine. They just told me to show up.
Oh, well,
I'm just kidding.
there you have it. You look fabulous. So give us what you got.
So hello, everybody. So if you were with us on last week, we talked a little bit about what is really happening in our government in Lansing. There's a lot of going back and forth, and just really quickly, what we said last week was there's $2.1 billion that was at stake. That is monies that has already been designated by the federal government, meaning the monies, they've already sent it. They're not waiting on anything. Those monies were supposed to be appropriated to our schools as part of pandemic relief. Well, it's so funny. I was listening to Jamal as he came on, and he talked about how, politics and the process sometimes can be quite silly, and when lives are at stake. And that is exactly what is happening right now. So we have pretty much a tug of war between, politicians about power. And so right now where we are, we currently have, I'm going to give you 3 bill numbers because there are some folks on here who may want to look these up. I want you to look at House Bill 4047, House Bills 4048 and House Bills 4049. For those of you that really want to delve deeply into this, you could do a little bit of research because that's going to be very important. So what has happened now is that the House, as of last week and earlier this week, pretty much voted on what they wanted, how they wanted the bills to kind of be rolled out. And so essentially what's happening is, unless Governor Whitmer pretty much signs off on relieving some of her pandemic power, a lot of this money is not going to be appropriated to the schools. Also, what has happened since yesterday, there is an additional thing that's kind of been tied into this. I don't know where it stands as of right now, but as of yesterday, they also have stuck in there that kids or that schools have to do 20 hours of in-person schooling if they want to get the coronavirus or the pandemic funds released to them, which of course this adds another layer of craziness. And so pretty much in a nutshell, there's a lot of going back and forth. There's some changing. There's a lot of negotiating that's happening. And at this point, it's up to the governor pretty much. We don't know what she's going to sign, what she's going to veto. We just don't know how this is going to fall out. But what I will say to you is this. As we said last week, there are two folks who's pretty much in the thick of this thing. And there may be, I think we may have some information going across the screen. We know that Representative Thomas Albert, who is the House Appropriations chairperson, was pretty much, he sponsored this bill originally that pretty much said, hey, we don't want the governor to have the sole right, or the Department of Health and Human Services to have the right to close down schools and to shut down sports events. And so we don't want her to have that power. So what we're asking is that folks would get on the phone, get in their emails, send messages to these representatives to let them know that the people of Michigan, our children, our schools, our teachers, we don't have any business in the middle of whatever this fight for power is all about. There have been some changes. We're hearing now that they want to, instead of, they want to limit the ability to close to just 28 days. So if the Department of Health and Services, for instance, if there was another wave, the Department of Health and Human Services could say, okay, we're going to shut things down, but it would be a 28-day limit. And then after 28 days, then the legislature would have to step in and vote. All of this going back and forth, and it is quite confusing. I realize that the average citizen is not caught up in this. We're not looking at bills. We're not reading through budgets. But what we do know is we want our children and our schools and our neighborhoods to be safe. And I say neighborhoods because also in these bills is tied up rental assistance. You have property tax relief in there for delinquent taxes. You also have monies that's tied in there as it relates to EBT or for families who need help with meals. There's so much that the people of the state of Michigan just deserve so much better. So we're asking, I don't know if there's something that's coming across the screen, but Representative Thomas Albert, I think there's information that may come up. If we can shoot him emails, especially if you're watching this and you're in his district, we want you to tell him to release the money, appropriate the money. And then also the Senate Appropriations Chair, Mr. Stamas, S-T-A-M-A-S. He also, we need to write him and email him and say, let's cut this out. We need money for our schools and for people now. Also tied up in that money is also unemployment money. I know Jamal Simmons just mentioned unemployment dollars coming down from the feds. So folks can have additional monies in their checks while they're not working. Well, that's all tied up in this thing too. It's up to the Appropriations Committee to release the funds, even though the funds are there, They are the ones that are assigned to release it or to appropriate it. And that's not happening because, quite frankly, they're horse trading right now. They're twisting arms. They're trying to make folks do one thing and do something else. So in a nutshell, folks, we just need everybody in on this. You may not like politics. You may say, hey, look, I don't want to get involved. Well, we need you to get involved. If you can send a text, then you can send a text to Rep. Albert's office or even Senator Stamas, and you can say, stop the games, release the money now. And Christine, pretty much that's it.
Thank you so much for giving us that update. While we know there's movement, there's more work that we can all do together if we believe that the money should be released. And so thank you for leading the efforts in getting that information out and organizing some ways in which we can reach out and let our voices be heard around it. So thank you so much. And hopefully we'll see you next week. I hope. I enjoy having you here. All right, so we're gonna move on. And it's been a long year, and we have always found some peace when we have Kimberly on from Spirit-Filled Yoga and Wellness Center. And we thought it would be really wonderful to have Kimberly come back us through some
move and yoga means we need to connected to the nice and long, but let the front of your body be relaxed and soft. So that in our yoga breath, we're going to breathe in through our nose, but we're going to let that breath come all the way down to our bellies and expand, and then just blow it all out. And maybe even for this first breath, squeeze your belly button all the way to your spine to empty out the breath, and then breathe in and allow the belly to expand. Breathe out gently this time. And now I'm going to add a movement to our breath. We're going to call this our butterfly breath. Take your arms as you inhale, just open them wide like the wings of a butterfly. Blow breath out, just give yourself a wonderful hug, crossing one arm over the other, and then repeat that. Open your arms nice and wide, butterfly wings, and exhale, breathe out, and then rest your bodies. For our movement today, we're going to increase our circulation by kind of wringing out our body. Think of your body and your organs, especially, as absorbing all of the toxins and things that we eat. So just like a sponge, when it gets full, we need to wring it out. So you can bring your hands together, palm to palm in prayer position. I'm going to adjust my camera just a little bit so you can see more of me. Pressing your soles of your feet into the floor for support. Your back is nice and long. Breathe in, let your belly expand. And then as you blow the breath out, just rotate your body to one side as though you're squeezing out all of that breath. And then breathe in, feel your body coming back to center. And then squeeze out the breath to the other side. You're giving yourself a nice little massage to your internal organs, right? Last but not least, we're going to return to center as our time is almost done, right? You can even bring your hands to your heart, feel it beating. We'll do a seated meditation, bring ourselves to a place of quiet and stillness. When we're done, I highly recommend a nap because naps are good. Our body does an awful lot of healing for us when we allow it to rest. And as you breathe in and out, inhale, feel your body filled with breath and say to yourself, I am healthy. And as you exhale, feel that healthy breath surrounding the outside of your body. Once again, breathing in, and this time say to yourself, I am strong. As you exhale, feel that breath of strength surrounding the entire outside of your body. And lastly, but not least, breathing in, say to yourself, I am wise. And as you exhale this breath, I invite you to bring your hands together once again, palm to palm. Breathe naturally and just connect to the truth of who you are, healthy, strong, and wise enough to make all the right decisions in the season of our continued wellness. So, my friends, thank you so much for this opportunity to share with you. Be well.
Thank you so much for that. It's a wonderful way to end our town hall today. As we reach the end here, it's time to wrap up. Before we move forward, I did want to acknowledge that we appreciate all comments and concerns that are shared. And today there were a few comments that came to us. We wanted to let you know that we heard you, and we will be sure to clarify any misinformation that may have been shared during the initial parent commentary that began this show. We thank you for your trust, but we will definitely address that in the coming weeks. Thank you. Also, thank you to all of our— Yes.
Rajeshi, Rev Simmons just wants to also address, just clarify a comment. So Rev,
Yeah.
go ahead.
So as Elisa was presenting her information on the state of the allocation of funds for our schools, it's important to understand that we're asking all the folks who are listening in, whether you agree or disagree with the budget that's been passed by the legislature, it is important that you understand we're asking you to express your opinion. We think a great many people will want to make sure that our children don't suffer for grown folks' disagreements. But whichever side you're on, please make sure that you take the time to express your point of view so our representatives can.
Thank you so much, Rev. I appreciate your clarification. And Rajeshi, back to you.
Thank you so much.
Close us out.
Great. I love it. The commentary at the end. It's perfect. As we just wanted to extend a sincere thank you to all of our panelists and a thank you to each of you for joining us today. If you had a question that wasn't answered or you think of it later, let us know. We will get the answers and post them next week on detroitpbs.org and on the DPTV Facebook page. This town hall is truly a group effort. So before we go, we would like all of our partners to turn on their video. And we want to remind you to stay healthy, stay powerful, and stay strong. Thank you so much, and we will see you next week.
Ophelia, will you please say that in Spanish?
Or not.
You're Ophelia, you're a little robot-like, but we'll make